Hello everyone, I'm Dr. Sakamoto. Today, I want to talk in detail about osteoarthritis of the hip. On this channel, we share videos about regenerative medicine and other medical topics. Please subscribe to our channel. First, let me explain about how the joint works. The hip joint is the largest of all the joints in the human body. It's very crucial for walking, running, and supporting the body. Please take a look at this diagram. The joint is shaped like a ball and socket, with the ball-shaped femoral head fitting into the socket-like part called the acetabulum. Both the acetabulum and the femoral head are covered with cartilage on their surfaces. Many of the patients are women. The most common cause is congenital hip dislocation. It's a deformation caused by a shallow acetabulum from birth. Other causes include the wearing down of cartilage as we age, or deformities in the hip joint progressing due to fractures or injuries. Conditions like Perthes disease and avascular necrosis of the femoral head can also cause deformities. Next, let's talk a little about the symptoms. Most of the pain usually tends to occur in the groin area of the hip joint. However, as shown in this illustration, pain often occurs in other areas too, such as the front of the thigh, the outside of the knee, and from the lower back to the buttocks. Pain that occurs outside of the hip joint is called referred pain. For example, when you eat cold ice cream and your temporal region of your head hurts, or when you have a heart attack and your back hurts, you are having a referred pain. Pain that appears in a different location from the actual cause of the condition is called referred pain. When referred pain is causing discomfort in the thigh, knee, or buttocks, it's often misdiagnosed for back problems, sciatica, or knee disorders by orthopedics. The symptoms progress, a phenomenon called limited joint mobility occurs, where the joint movement becomes stiff. And when this limited joint mobility occurs, a condition called joint contracture can also happen. When joint contracture occurs in the hip, it can cause discomfort and pain in the hip area, even when lying on your back, because the hip joint doesn't fully extend. Next, I'll briefly explain about X-ray findings. Please take a look at this X-ray image of a normal hip joint. And this is the X-ray finding of a deformed hip joint. In the early stages of osteoarthritis of the hip, it can be difficult to distinguish from a normal hip on an X-ray. However, in the advanced or late stages, the joint space becomes narrower, as shown in this picture. In addition, bone spurs and bone cysts will develop. A bone cyst is a condition where a hole forms in the bone and is often filled with fluid. As the deformation of bone cysts progress, it can grow larger or increase in number. Additionally, bone cysts can form not only in the bone head, but also in the acetabulum. As seen in this X-ray, if a bone cyst collapses, it can cause intense pain and may require emergency surgery. Next, let's talk about acetabular dysplasia, which accounts for 80% of the causes of osteoarthritis of the hip. Let's take a closer look using X-ray picture as well. First, here is an X-ray of a normal hip joint, and this X-ray shows a case of acetabular dysplasia. There's a slight difference in the socket that holds the femoral head. The acetabulum of the socket part is slightly narrow. In other words, the area of this part is significantly reduced overall in size. When the area of the acetabulum is particularly narrow like this, it puts a lot of stress on that part, making it prone to cartilage reduction and deformation. Now let's talk about some key points. Symptoms and X-ray findings don't always match up. For example, some people don't feel any pain even if the X-ray shows significant deformation. On the flip side, there are people who experience significant hip pain even if the X-ray shows that it is in the early stages of deformation. Now, let's talk about the situations where surgery of prosthetic joint implant becomes necessary. Surgery is necessary in cases of severe pain. If the pain in your daily life is extremely unbearable, or if it's so severe that you can't work, you have to consider having a surgery. On the other hand, even if the deformation is quite severe, if there's not much pain, you don't need to opt for surgery. And in some cases, the hip can be quite painful even in the early stages of deformation. In this particular case, it's more common to choose a surgical osteotomy rather than opting for a hip replacement procedure. An osteotomy is a surgical procedure where your own bone is cut and reconnected in order to reshape the joint. Sometimes, instead of prosthetic joint implant, an osteotomy can be used to address the issue. However, even with this bone-cutting technique, there are many cases where deformation occurs again after a dozen years or so, and ultimately, a prosthetic joint implant becomes necessary. Another option, other than these surgeries, is regenerative medicine using stem cells, which is increasingly gaining more attention these days. At our clinic, we've handled numerous cases of regenerative medicine using stem cells for osteoarthritis of the hip. Today, I've explained about osteoarthritis of the hip. Thank you very much for watching.